Some foods that are perfectly safe for humans can be extremely dangerous for dogs. Even a small amount may cause severe poisoning, organ damage, or even become life-threatening if not treated in time. Chocolate contains two toxic compounds for dogs, caffeine and theobromine. Because dogs metabolize these substances very slowly, they accumulate in the body, overstimulate the nervous system, and put excessive strain on the heart. Not all chocolate is equally dangerous. White chocolate is the least toxic, milk chocolate poses a moderate risk, while dark chocolate and cocoa powder are among the most toxic forms for dogs. Chocolate poisoning does not always appear immediately. Symptoms can begin within 6 to 12 hours after ingestion and may persist for several days if proper treatment is not provided. Grapes and raisins are among the most mysterious toxic foods for dogs. Scientists now believe that tartaric acid and potassium bitartrate are the primary substances responsible for their harmful effects. Raisins are even more dangerous than fresh grapes because the toxic compounds become concentrated during the drying process. More importantly, there's no known safe dose, as individual dogs can react very differently. After eating grapes or raisins, dogs often begin vomiting within the first several hours. If poisoning progresses, acute kidney failure may develop within 1 to 2 days and quickly become a medical emergency. Onions, garlic, and chives all belong to the allium family. Whether they are raw, cooked, baked, or dried, these foods remain toxic to dogs. The compound thiosulfate found in allium vegetables damages red blood cells. As more red blood cells are destroyed, dogs can develop hemolytic anemia, a serious condition that reduces the body's ability to carry oxygen. Garlic is significantly more toxic than onions and can become especially dangerous when fed regularly in small amounts. One challenge is that symptoms often appear several days later, making the true cause difficult to recognize. Cooked bones may look harmless, but they are actually one of the most dangerous foods a dog can swallow. Heat destroys the bone's natural flexibility, making it dry, brittle, and likely to splinter into sharp fragments. Shucks said when a dog chews a cooked bone, it can break into razor-like shards. These fragments can easily injure the mouth, throat, stomach, or intestines as they travel through the digestive system. One common consequence is intestinal obstruction. Large bone pieces may become stuck in the esophagus or digestive tract, blocking the normal passage of food and causing a life-threatening emergency. Even more dangerous, sharp bone fragments can puncture the intestinal wall. Once this happens, digestive fluids and bacteria can leak into the abdominal cavity, leading to severe infection. And without rapid surgery during the critical golden hours, intestinal perforation can quickly progress to fatal peritonitis. This is why cooked bones should never be given to dogs. Another hidden danger comes from xylitol, an artificial sweetener commonly found in sugar-free gum, diet candies, mouthwash, and some peanut butter products. Unlike humans, dogs respond to xylitol by releasing a massive amount of insulin. This sudden hormonal response causes blood sugar levels to drop dramatically in a very short time. Symptoms of xylitol poisoning can begin within just 10 to 60 minutes. Dogs may become weak, disoriented, shaky, or even suffer seizures due to severe hypoglycemia. At higher doses, xylitol can also cause irreversible liver damage. Even 1 or 2 pieces of xylitol-containing gum may be enough to kill a small dog if treatment is delayed. Because xylitol acts so quickly, every minute matters. If you suspect your dog has eaten a product containing xylitol, contact a veterinarian immediately and head to the clinic without delay. Excessive salt consumption can also be deadly for dogs. When a dog eats too much salt without enough water, the balance of fluids inside the body becomes severely disrupted. As salt levels rise in the bloodstream, water is pulled out of the body's cells in an attempt to dilute the excess sodium. This process can affect every organ, including the brain. When brain cells lose too much water, serious neurological problems may develop. Dogs can experience confusion, tremors, seizures, and in severe cases, death. The risk increases significantly when dogs are given heavily salted foods or snacks intended for humans. Preventing access to these foods is far safer than treating salt poisoning later. If you discover that your dog has eaten a toxic substance, the first step is to stay calm and identify exactly what was consumed. Knowing the product, quantity, and time of exposure is extremely important. Carefully inspect the area and gather any useful evidence. Food packaging, ingredient labels, and remaining product samples can provide critical information for the veterinarian. As soon as possible, contact a veterinary clinic and explain the situation. Early communication allows the medical team to prepare the appropriate treatment before you arrive. Some toxins, especially xylitol, can begin causing life-threatening effects within minutes. In these cases, immediate transportation to a veterinary hospital is essential. If veterinary guidance is available, induced vomiting may sometimes be recommended during the first 1 to 2 hours after ingestion. This can help remove toxins before they are absorbed into the body. However, vomiting should never be induced without professional instructions. The wrong decision can make the situation worse and may cause additional injuries to your dog's digestive tract. There are important situations where inducing vomiting is not safe. If a dog is unconscious, extremely lethargic, or unable to swallow properly, attempting to make it vomit can lead to choking or aspiration. Vomiting should also be avoided when a dog has swallowed sharp objects such as cooked bone fragments. Bringing those sharp pieces back through the esophagus can cause additional injuries. The same rule applies to corrosive substances like acids, cleaning products, and strong chemicals. These materials can burn the digestive tract once, and vomiting may force them to cause damage a second time. When in doubt, always seek veterinary advice before taking action. A professional can determine whether inducing vomiting is appropriate based on the toxin, the amount consumed, and the time since exposure. At this point, we have covered the 6 major household dangers for dogs: chocolate, grapes, allium vegetables, cooked bones, xylitol, and excessive salt. Although these toxins affect the body in different ways, they all share one important characteristic: early recognition and rapid treatment dramatically improve the chances of survival. The safest approach is prevention. Keeping toxic foods out of reach is far easier, less expensive, and much safer than dealing with a poisoning emergency. Store chocolate, sugar-free products, onions, garlic, grapes, and other risky foods in secure locations that curious pets cannot access. A simple household safety routine can prevent many accidents. Checking countertops, tables, bags, and food storage areas reduces the risk of unexpected exposure. Remember, dogs often investigate the world with their noses and mouths. A few moments of prevention today can save your pet from a life-threatening emergency tomorrow. Many poisoning cases happen because dangerous foods are left unattended on tables, countertops, or inside easily accessible trash bins. A few simple storage habits can greatly reduce these risks. Keeping toxic foods in sealed containers and secure cabinets creates an important barrier between curious dogs and potentially life-threatening substances. Trash cans deserve special attention. Leftover bones, onion scraps, candy wrappers, and other food waste can attract dogs and expose them to hidden dangers. A secure trash bin with a locking lid is one of the easiest and most effective ways to prevent accidental poisoning at home. It is also helpful to learn which treats are safe for dogs and which human foods should never be shared. Not all foods that are safe for people are safe for pets. Being prepared before an emergency occurs can save valuable time. Keep veterinary contact information easily accessible and know where the nearest emergency clinic is located. Different dogs may react differently to the same toxin. Puppies, senior dogs, and smaller breeds are often more vulnerable because of their size or health condition. However, no dog is completely immune to poisoning. Regardless of breed, age, or size, every dog can be affected if the exposure is significant enough. The most important lessons are simple: recognize dangerous foods, store them safely, act quickly during emergencies, and seek veterinary care as soon as possible. By combining prevention, awareness, and rapid action, you can dramatically reduce the risk of poisoning and help ensure your dog lives a longer, healthier, and safer life.